Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
All right, we have Dr. Ene Onazi. She's a doctor of medicine and is certified by the Education Commission for foreign medical graduates. She's registered with the Hungarian Medical Council and, of course, the Irish Medical Council. Now, she'll be here to us. We're talking about signs of a stroke and identifying symptoms of a stroke and what to do immediately. Hello, Dr. Ene. How are you doing?
Hi, good morning. How are you?
I am good. I am good. Now, we just saw a video of someone who just suffered a stroke and all of that. Even it's really can be scary. But let's just get straight into it. How do you know? How do you know that someone is there any sign that a stroke might come? First of all, let's start with that. Is there any sign, maybe signs that you have to look out for that make someone more susceptible to having a stroke?
Yes, there are many signs you can look out for, especially many illnesses or diseases or conditions your doctor has probably mentioned to you.
Okay.
If you have been told that you have hypertension or high blood pressure, or you have had diabetes for a long time, or you have a high level of cholesterol, or you have been inactive for a very long time, I mean, I'm talking about years. These are all factors, or they are all things that can contribute to you having a stroke.
Oh, wow. Okay. So what are the early signs? Now, apart from having these ones, now, what are the early signs that it is impending? I'm talking about maybe something you can see in months and all that. Are there any signs like that that let you know that it's getting very close? Impending signs?
Yeah, you can say that. We have something called a TIA. It's
Okay.
called a transient ischemic attack. Now, what it is something that is like a mini stroke. It's like a small stroke. It doesn't last long. It comes and it passes. So you get the similar symptoms of a stroke, but to a lesser degree sometimes. And it doesn't last as long. It stops like maybe within 5 to 20 minutes. All those symptoms go on their own.
What are those symptoms? What are those symptoms you're talking about?
So the symptoms are you lose your coordination or balance. So you either trip or you tend to stumble, or you cannot even walk properly anymore. That you lose your coordination. Another symptom will be your eyesight. So you can either have blurry vision for a period of time or a partial loss of vision for a period of time. Another one would be your face. You can feel like numbness on one side of your face, or you feel like your smile looks awkward when you're trying to smile, just like we saw in the video. Very similar symptoms. You can also have your arm or your limb, your arm or your leg can be weak, so you can trip over without even realizing you're tripping over. You understand? And then your arm gets very weak. If somebody asks you to raise both your arms up, you notice that you can't keep one of them as high as the normal one. So usually it's always on one side it affects. Then your speech too is very important. If you notice that over time, not over time, but during the period of having that mini stroke, your speech gets slurred, you're not audible anymore. You sometimes, if you're eating, you can even choke because the brain controls parts of your muscles that help you swallow. So that's also another sign of knowing that.
All right. So what do we do? What can we do immediately if there is no, if people are around? What can they do? And then what? Also, let's look at the case of where nobody's around and you're probably the only person around. What can you do, or what should you do immediately?
If you're the only person around, there's this acronym we have in medicine. It's called Be Fast. So why we call it Be Fast is because it's something that's so acute, so immediate. You have to be very quick to know what to do and how to recognize the symptoms. Be fast. So I mentioned most of it. B stands for balance, E stands for eyes, F stands for face, A stands for arm, S stands for speech, and T stands for time. Now, the time is one of the most important factors for you, because the moment you feel something is going wrong, you need to time when that happens. Because the timing is very important for the doctors to be able to treat you properly, the surgeons to be able to treat you properly. There are different treatments based on the different times, how different on how long the stroke has lasted for. So those are the very important things you need to remember. If you're alone, timing is extremely important. Call somebody as soon as possible.
Call somebody as soon as possible, and then the person gets there. What's the next thing to do?
Well, if the person gets there, the person has to try and make sure you stay conscious. Person has to protect you from falling over, hurting yourself, because that part of your brain, what happens during a stroke is a part of your brain is not getting enough blood supply for that period of time, and you don't know the part of the brain that's not getting enough blood supply, so you don't know what parts of the body is going to be affected, right? So what you want to do is make sure that that person doesn't hurt themselves. Similar to a seizure, you want to make sure the
Okay,
person is
Dr. Ene, let's hold it at that person doesn't want to hurt themselves. We'll pick up. We just want to take a short break, a commercial break. We'll pick up exactly from that point. All right, we're back. We're not going to leave you, and Dr. Ene is definitely not leaving us. Now, Dr. Ene, we're talking about, we're going to pick up from where you spoke about when the person comes around and what to check for, right? Let's pick up from there. So when you've called somebody, the person has arrived, and you're suffering maybe the symptoms of a stroke and all that, what does the person do?
Yes, so the first thing that person wants to do is make sure that you are safe. When we say safe, we mean you are not close to anything that could hurt you. You're not going to fall. You need to be seated, or you need to be laid down in a comfortable position that's safe for you. You need to essentially, once that person is when you can be sure that that person cannot hurt themselves, you are keeping an eye on them. You can now call the ambulance, or find a way of getting that person to the hospital as soon as you can.
All right, okay. Now, there are also some illnesses that seem like they are a stroke. I know that there's a possibility of some other illnesses that seem like they might be a stroke. Do you have any idea of what kinds of illnesses, and if they are maybe treated, or if they are going to be approached in a different way from the way you would approach a stroke? Some kind of symptoms that might seem like a true stroke.
Similar to a stroke, a brain stroke, the only possible thing will be having a seizure. That is when you have increased or reduced brain activity, depending on what's going on in your brain. A seizure is similar to a stroke, but it can be from different causes or different kinds of seizures. You can have something that the person is just staring into space for a long period of time. You can have something where the person starts shaking after that period of staring into space. Their entire body starts shaking. You also have to make sure that person is protected during that seizure. So some people who have epilepsy, like most people would know, would have seizures, chronic seizures that occur frequently. So that is one major illness that's similar to a stroke, but different. They have a different background.
All right. Now let's talk about age, the age factor here. Can someone be too young to suffer a stroke? What's the earliest age someone can suffer a stroke? Is it age dependent? What role does age play when it comes to the issue of strokes?
That's a very good question. Yes, the older you get, yes, it's possible that you get your risk of stroke increases, because then you have other conditions to worry about, like I mentioned earlier, hypertension and diabetes, which you have to control very, very well in order to reduce your chances of having a stroke. But that said, medicine is not particularly absolute. So anybody can have a stroke from whatever age, from a kid to an adult to an elderly person, because a stroke is just when you have a blood clot that gets stuck in a smaller vessel in the brain, and anything can cause that blood clot. So we don't say, okay, only this particular age group can have a stroke. Any age group can have a stroke.
Any age group. What's the youngest you've ever had to encounter before personally? What's the youngest age?
Personally, this was in the States when I was taking a practice there, and this was I think she was 28 or 29. It was a lady, 28, 29. She had many other issues going on that culminated or that added up in her having a stroke.
All right, now post-treatment, post these stroke symptoms, and maybe the person has been taken to the hospital, there's been treatment, and then there's some sort of recovery. Post this period, what can somebody do to ensure that these things do not come up again, or maybe the risk is limited? What can one do?
After that kind of an experience, you have to basically take care of yourself more. It's very, very important because everything in your body is controlled or related to the brain in some shape or form. You want to make sure you listen to everything your doctor tells you and you have to stick to it. Regarding the general lifestyle of Nigeria, for example, of our nation, we have to be a little bit more healthy with our oily foods, fatty meals, and all of that. We can have them, but in moderation, and less is more. Fish is always acceptable regarding your diet. So, yes, those are the things you can do after a stroke. Make sure you're healthy, active, avoid things that are, not healthy for your blood and your heart, so to
Yeah,
speak.
so personally, I like fish. Maybe if you're looking like maybe like croaker, but I like it fried.
Yeah.
And then there are some people that have a proclivity for maybe like catfish or something. Like, when you mentioned that fish, I was not thinking. So I'm also thinking about my life, about the things that I take. So fried croaker is normally very, very, very. I cannot resist fried croaker. It's fried and all of that. But when you say
Yes, I
fish and all of
understand.
that, would you say fresh fish, taking fish freshly, that if it's maybe cooked without being fried, would be a better option than maybe having fried fish or something?
Oh, okay. No, you can actually bake. You bake fish, baked fish, roasted fish. You can use some oil, just a little bit, but deep frying, no, not advisable. Yeah, shallow frying is okay. You use moderate oil, but baking and roasting is very okay and healthy as well.
Okay, generally, now you made mention of fatty foods. Now, look, let's look at a Nigerian diet. You always have to deal with, of diet, rice, beans, yam, pounded yam, goosey soup and all of
Yes.
that. There's just so much carbohydrates and all of that. Does that have would that have a factor to play maybe in making one more susceptible to symptoms of a stroke? Looking at the average Nigerian diet.
Especially if we want to talk about the foods, especially palm oil. Yes. And we tend to use that a lot in our soups.
Palm
So
oil.
if
Wow.
yes, so if you must use palm oil, it's always advisable to keep it to a small amount, a tablespoon or a couple of tablespoons for the entire meal. If any of you have tried dieting, you will hear stuff about having white soup instead of having normal soup. That white soup is basically telling you to avoid palm oil. You understand? So every other thing, pounded yam and everything else, always in moderation and smaller amounts is always advisable the older you get, because as you get older, your body is not as strong and as fast, and your metabolism is not as great as it used to be. How you break down food is not as great as it used to be. So you have to be very observant and you have to watch your portions with all those extremely starchy foods, extremely fattening foods, oily foods, and all of that.
Man, this is hard, though. So pounded yam now that, there's people that as they grow older, they start with 4 wraps,
Yeah,
they move to 5 wraps, 6 wraps, and all of that. You are saying
I
that
know,
it should
right?
be in moderation here.
Yes, the thing is, when you are trying to change your diet and be more healthy, you are not going to do everything all of a sudden. So you are used to a certain lifestyle, and when we advise getting healthier, we advise you to take gradual steps. So if you're somebody that likes 5 wraps of pounded yam, for example, now, and you want to get healthier, next time you want to eat 5 wraps, try and reduce it to 4 or 3. See how you do with that. Over time, you reduce it, like with maybe the next couple of weeks, you can now reduce it to 3, reduce it to 2. Your body will slowly adapt and get used to it. So that's one of the ways we try to make you stay healthier.
Thank you so much, Dr. Ene. It's always a pleasure talking to you, and I'm looking forward to what we'll talk about next week. Have a wonderful day.